Your chest feels a little tight. You think it's stress. You loosen your collar. You take a slow breath. You wait. That decision, that single moment of waiting, kills over 300,000 people every year in America alone. Most of them felt something. Most of them knew something was wrong. And most of them made the same fatal mistake. They waited for the pain to look like it does in the movies. It almost never does. Here's what cardiology textbooks confirm, but nobody says loudly enough. The dramatic clutching the chest Hollywood heart attack accounts for a minority of actual cardiac events. The majority arrive quietly, disguised, wearing the costume of indigestion, fatigue, jaw tension, or a vague feeling that something is simply wrong. Not painful enough to panic, just wrong enough to notice. And in that gap between noticing and acting, heart muscle dies. Permanently, irreversibly, by the minute. Stay with me, because what I am about to show you could be the most important biological knowledge you ever carry. Here is what is actually happening inside your body before the event. Your coronary arteries are the dedicated fuel lines supplying blood directly to your heart muscle. Over years, silently, without a single symptom, cholesterol and inflammation accumulate inside those walls like rust building inside a pipe, forming what cardiologists call a vulnerable plaque, a pressurized bubble of unstable material beneath the artery's inner surface. It does not hurt. It does not slow you down. It simply waits until one moment, a blood pressure spike, a surge of stress, sometimes nothing at all, that plaque ruptures. The body responds like it does to any wound. Clotting agents flood the site. A clot forms, and within minutes, that clot seals the artery entirely. The heart muscle downstream stops receiving oxygen, and it begins to die. Now pay attention. This is the window that changes everything. 10 minutes, sometimes 30, before complete blockage. Your body is already broadcasting distress in a language most people were never taught to read. You feel pressure in your chest. Not sharp, not stabbing, like someone placed a heavy book on your sternum and left it there. You shift position. You think probably tension, probably nothing. You feel a dull ache in your jaw. Left side. You think maybe I slept wrong. You feel suddenly short of breath, sitting completely still. No exertion. You think probably anxiety. Cold sweat appears without heat, without effort. Your nervous system has recognized a cardiovascular emergency and is pulling the alarm. You wipe it away and keep sitting. And then comes what cardiac survivors describe most consistently: an overwhelming sense that something is deeply and fundamentally wrong. Not painful enough to justify panic, but persistent, unshakable. The medical literature has a clinical term for this: a sense of impending doom. It appears in cardiology textbooks as a documented symptom of acute cardiac events. Not metaphor, clinical documentation. Your body is communicating in every language it has, and the average person responds by waiting 2 hours. Here is the number that should make every person sit up. The American Heart Association confirms the average patient waits 2 full hours after symptoms begin before calling for help. 2 hours, during which the clot grows, during which clot-dissolving medications that work brilliantly in the first 90 minutes become dramatically less effective. Cardiologists use one phrase that carries the weight of everything. Time is muscle. Every minute of oxygen deprivation destroys cardiac tissue that does not regenerate, does not repair, does not return. The gap between noticing and acting is the biological distance between full recovery and permanent heart damage. Here is the protocol, not theory, action. The moment you or anyone near you experiences any combination, chest pressure, discomfort spreading to the arm, jaw, neck, or back, sudden shortness of breath, cold sweat, nausea, or that unshakable sense that something is wrong, do not drive. Do not wait. Call emergency services immediately. Ambulances do not simply transport. Emergency teams begin treatment on contact. They transmit heart data to the hospital in transit, so surgical teams are prepared before the patient arrives. That preparation time translates directly into cardiac muscle saved. While waiting, If the person is conscious and not allergic, one regular aspirin chewed immediately slows the platelet activity, worsening the blockage. The American Heart Association recommends this specifically for this window. Keep the person calm, sitting upright, collar loosened. Stress elevates heart rate and blood pressure at the exact moment the heart can least afford either. And before any of this becomes relevant, know your numbers. Blood pressure, cholesterol, blood sugar. These are not wellness checkboxes. They are the earliest readable chapters of the story that ends in a cardiac event, written silently in your arteries years before any plaque ruptures. Knowing and managing these numbers is the only intervention that works at the true biological root. Most survivors reflect on the same thing honestly. They knew. Something in them recognized that what they were feeling was not ordinary. And many admit they chose to hope it would pass rather than act as though it might not. You now carry the knowledge that changes that choice. The 10 minutes before a heart attack are not a countdown to an ending. For the people who recognize the signals and act without hesitation, they're the 10 minutes that make survival possible. So here is the question worth carrying after this ends. If the person nearest to you felt these things in the next hour, the chest pressure, the jaw ache, the cold sweat, that unshakable wrongness, would you recognize it fast enough to act? Because that recognition and the speed of the decision that follows is the only thing that turns those 10 minutes into a story someone gets to tell later.